Imagine a community grappling with the terrifying prospect of their local hospitals being gutted by budget cuts and job losses. This is the grim reality facing Cornwall residents, who are now sounding the alarm about the potential, devastating impact on patient care. At a recent Cornwall Council Health Scrutiny Committee meeting, concerned citizens confronted officials about the Royal Cornwall Hospitals Trust, RCHT's controversial plans, which have already sparked protests outside Cornish hospitals. But here's where it gets even more alarming. RCHT, which oversees the Royal Cornwall Hospital in Truro, St Michael's Hospital in Hale, and West Cornwall Hospital in Penzance, has announced not one but two waves of potential job cuts. Initially, they proposed slashing over £49 million by reducing administrative roles from 600 to 450. However, after intense union pressure, the Trust has temporarily paused the admin job consultation and extended the clinical job consultation. Is this a genuine reprieve, or merely a tactical delay? And this is the part most people miss. RCHT spent a staggering £412,400 plus VAT on hiring Kingsgate Consultancy to manage the job consultation process. During the meeting, St Austell resident Mr. Evans boldly questioned the justification for this expenditure, especially amid such severe financial constraints. He asked, who approved this public money for Kingsgate, and why are these changes being rushed through during winter, when hospitals are already under immense pressure? The Trust's response? They claim Kingsgate's appointment was necessary to accelerate their 2025-26 operational plan, including a £49.3 million cost improvement program. But is outsourcing to expensive consultants the best use of funds when frontline services are at risk? Another resident, Mr. Seaborn from Truro, raised a critical point. With £49 million in cuts this year, on top of £30 million already slashed, and rumours of another £40 million next year, how can our hospitals possibly cope? The committee's response was vague, emphasizing erroneous efficiency and maximizing productivity. But what does this mean for patients and staff in the trenches? Ms. Bess from Bodmin introduced a controversial angle. Are the Trust's leaders prioritizing privatization over re-evaluating high-paid executive roles? The Trust insists it's committed to in-house service development, yet the question remains, are they truly exploring all options before sacrificing patient care? Cornwall Health's restructuring, which threatens redundancies among its most experienced staff, further complicates matters. Mr. Bramwell from Truro asked, isn't retaining seasoned staff crucial for maintaining care standards? The committee's response was diplomatic, citing HR processes and service quality, but are these assurances enough to calm fears? Finally, Mr. Albert from Truro highlighted a looming crisis, with hundreds of clinical administration jobs set to be cut around Christmas, and new computer systems not arriving until mid-next year. What safeguards are in place to prevent chaos? The Trust claims it's balancing modernization with cost-effectiveness, but is this timeline realistic, or a recipe for disaster? As the debate rages on, Liberal Democrat Councillor Ruth Gripper questioned whether the Health Scrutiny Committee should hold the Trust more accountable. Yet, she was told the restructuring falls outside their purview. Is this a cop-out, or a necessary boundary? Here's the bigger question. Are these cuts a necessary evil in a strained healthcare system, or a short-sighted decision that will cost lives? We want to hear from you. Do you think the Trust is making the right choices, or are they sacrificing patient care for financial targets? Share your thoughts in the comments below. Let's keep this critical conversation going.